ELI 5, how do some young athletes just suddenly drop dead from a cardiac condition? Shouldn't there be some warning signs? 1. Because sometimes the part that fails first is the critical part, and up until it fails there's no reason to suspect something is wrong. 2. Because the symptoms can be the same for otherwise normal things given the activities that person participates in. Hypertrophic cardiomyopathy, HCM, is the leading cause of sudden death among young athletes. The occurrences are incredibly rare, 1 in 50,000 to 100,000 per year or less by most estimates, but obviously it's shocking when it happens. It causes some of the walls of the heart to become stiff and thicken, which reduces blood flow. A couple of the symptoms are shortness of breath and fatigue. You know what else causes shortness of breath and fatigue? Exercise, especially heavy exercise. 3. As mentioned above, the occurrences are quite rare, so it's unusual to screen for other symptoms that might indicate a problem. Sometimes the downsides of the screening aren't worth the risk. Consider the following scenario, numbers made up just to demonstrate the point. Let's say there is a test you can do involving inserting a scope surgically in a patient to check their heart. The odds of developing any complication from the surgery are, say, 1 in 10,000. The odds of severe complications or death are 1 in 50,000. You are a cardiologist, you have 3 patients who come into your clinic, all exhibiting the same symptoms. One is 70, another 50, the other is 20. For a 70-year-old exhibiting these symptoms, the odds of it being serious are 1 in 10,000. Since that's well below the odds of severe complications from the surgical procedure, it makes sense to do it. Yes, they could die, but they are far more likely to die if left untreated. For the 50-year-old, the odds of it being serious are in 1 in 40,000. Now it starts to becoming a judgment call. The odds of dying from the condition aren't that far off from the odds of serious problems/death from the surgery. You probably want to monitor the patient for additional symptoms to narrow things down first, but you definitely need to keep the surgery in mind if the odds get worse based on your observations. For the 20-year-old, the odds of it being serious are 1 in 200,000. Chances are it's probably something else much less serious if there is any problem at all. Doing the procedure to investigate is 4x more likely to kill them than doing nothing. It doesn't make any sense to even consider the procedure. Sure, for that 1 in 200,000 case the outcome is bad, death, but by avoiding the procedure in this scenario, 3 other people who would have been killed are still alive.